Hi everyone, welcome back to my YouTube channel, and today we are going to talk about cardiovascular disease. So let's start our topic with introduction. Cardiovascular diseases refers to group of disorders that affect heart and blood vessels. They are among the leading cause of illness and death worldwide. These conditions include coronary artery disease, hypertension, heart failure, stroke, and congenital heart defects. Cardiovascular diseases develop due to multiple factors such as unhealthy lifestyle, genetics, aging, and environmental influences. Understanding the cause, symptoms, prevention, and treatment of cardiovascular diseases is essential for improving public health. Definition of cardiovascular diseases. Cardiovascular diseases are disorders that affect heart and blood vessels. They interfere with normal functioning of circulatory system, which is responsible for transporting blood, oxygen, and nutrients throughout the body. When the cardiovascular system is compromised, vital organs may not receive the oxygen they need, leading to severe health consequences. Types of cardiovascular diseases include coronary artery disease. Coronary artery disease occurs when the coronary arteries supplying blood to the heart become narrowed or blocked due to plaque buildup. There is a condition that is called as atherosclerosis. This reduces blood to the heart and can cause chest pain or heart attacks. Second type of cardiovascular disease is hypertension, that is also called as high blood pressure. Hypertension is condition where the force of blood against the artery wall is consistently too high, and it increases the workload on the heart and can lead to heart failure, stroke, or kidney damage. Third type of cardiovascular disease is heart failure. Heart failure occurs when the heart is unable to pump blood efficiently, and this can result from heart disease, high blood pressure, or previous heart attacks. Fourth type of cardiovascular disease is stroke. Stroke happens when the blood supply to part of brain is interrupted due to blockage, that may be ischemic stroke, or due to bleeding, that is called as hemorrhagic stroke, and this can cause permanent damage to brain tissue. Fifth type of cardiovascular disease is arrhythmias. Arrhythmias are irregular heartbeat. Either they are too fast, that are called tachycardia, or either they are too slow, that are called bradycardia or erratic. They disrupt the heart's ability to pump blood effectively. Sixth type of cardiovascular disease is congenital heart disease. These are structural abnormalities that are present at birth, such as holes in the heart or malformed valves. Causes and risk factors of cardiovascular disease. First, we will talk about modifiable risk factors. These are lifestyle related factors that can be controlled. They include unhealthy diet that are high in sugar, salt, and saturated fats, physical inactivity, tobacco use, excessive alcohol consumption, obesity or overweight, high blood pressure and high cholesterol, stress, and poor mental health. These are all the modifiable risk factors for cardiovascular disease. Now we will talk about non-modifiable risk factors. These factors cannot be changed, and they include age, as risk increase with age, family history of heart disease, gender, as male have higher risk at younger ages, but risk increase for women after menopause. Fourth is genetics or hereditary conditions. Signs and symptoms of cardiovascular disease. Symptoms vary depending on specific condition, but common signs include chest pain or discomfort, shortness of breath, fatigue and weakness, irregular heartbeat or palpitation, swelling in legs, ankles or abdomen, dizziness or fainting, severe headache, especially during stroke, sudden numbness or weakness of face, arm or leg, but not all individuals show symptom. This is why regular screening is important for cardiovascular disease. Diagnosis of cardiovascular disease. Healthcare professionals use various methods to diagnose cardiovascular diseases. They include physical examination, that is checking of blood pressure, heart rate, weight, and lifestyle habits. Second is imaging tests that include electrocardiogram, echocardiogram, X-rays or CT scan. Electrocardiogram measures electrical activity of the heart. Echocardiogram uses ultrasound to show heart structure and function. while X-rays or CT scan provide images of heart and blood vessels. There is another test that are called laboratory tests, as blood tests are done to check cholesterol level, blood sugar, and cardiac markers. We can also diagnose by stress test, that is to assess how the heart responds to physical activity. Prevention of cardiovascular diseases. First is by healthy diet, that is a diet rich in fruits, vegetable, whole grains, lean proteins, and that is low in salt and sugar, that help maintain heart health, and reducing processed food and trans fats is crucial for preventing these diseases. Second, we can prevent cardiovascular diseases by regular physical activity, that is at least 30 minutes of moderate exercise, that may include walking, cycling, or swimming most days of the week, help control weight, blood pressure, and cholesterol. Third prevention thing is to avoid tobacco, as quitting smoking significantly reduces the risk of heart disease and improve lung functions. Fourth preventive measure is to limit alcohol, as moderate or no alcohol consumption help prevent high blood pressure and heart failure. Sixth preventive strategy is weight management, as maintaining a healthy body weight reduces the risk of diabetes, hypertension, and heart strain. Sixth preventive strategy is stress reduction, as practicing relaxation techniques such as meditation, yoga, or deep breathing support heart health. And seventh preventive measure is regular health checkups, that includes routine screening that help detect early signs of cardiovascular disease and allow timely intervention. Treatment of cardiovascular disease. Treatment depends on type and severity of disease. It includes lifestyle modification, that are changes in diet, exercise, and stress management from the foundation of treatment. Second, include medications. Medications doctor may prescribe include blood pressure lowering drugs, cholesterol lowering statins, antiplatelets or blood thinning medications, and medication to slow heart rate and improve pumping efficiency. Medical procedures can be done for cardiovascular diseases, as some conditions require advanced interventions. These include angioplasty to open blocked arteries, stent placement, coronary artery bypass surgery, pacemaker implantation, valve repair or replacement, and then we do is treatment is rehabilitation, that is cardiac rehabilitation programs that assist patients in recovering and preventing further future events. Impact of cardiovascular disease in society. Cardiovascular disease have significant social and economic consequences, as high healthcare costs for treatment and long-term care is required for cardiovascular diseases, and there is loss of productivity due to disability or death. Emotional and physical impacts on the families occur because of these types of deaths, and there is increased burden on healthcare system, and public health strategies play a key role in reducing this burden through awareness, screening, and community-based programs. Conclusion of this lecture video. Cardiovascular diseases are serious conditions that affect millions of people worldwide. They are largely preventable through lifestyle changes such as healthy eating, regular exercise, avoiding tobacco, and controlling stress. Early detection and proper medical care can significantly reduce complications and improve quality of life. Understanding the nature, causes, prevention, and treatment of cardiovascular disease is essential for individuals and communities to take proactive steps forward towards health. And this was all about cardiovascular diseases. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.